Judge, I'm going to clean the outside of your ear before doing your ear drops.
Before administering otic medication or performing ear irrigation, gently clean any exudate from the child's outer ear.
Judge, would you rather lie down or sit up?
To administer otic medication, help him into a side-lying position with his affected ear up, or in a seated position with his head turned so the affected ear is up.
Bring your bad ear up, okay?
With your non-dominant hand, straighten the ear canal. To do this for a child over age 3, pull the pinna back and up. For a child age 3 or younger, pull the pinna back and down. Then brace your dominant hand on the child's head and hold the dropper just above the meatus.
Now I'm going to hold your earlobe so the drops can roll right down into your ear.
Instill the prescribed number of eardrops. After they're instilled, gently massage the tragus to promote eardrop movement down the ear canal. If prescribed, moisten a cotton strip with a few drops of medication and pack it loosely in the child's ear.
I'm going to need you to stay on your side for a few minutes so we can keep the cotton in its place.
To perform ear irrigation, place the child in a supine or seated position and put towels or moisture-proof pads under her head and shoulder. Have the child or parent hold a basin under the affected ear and tip that side of her head toward it. If needed, use a restraint technique. With your non-dominant hand, straighten the ear canal. For a child age 3 or younger, pull the pinna back and down. For a child over age 3, pull the pinna back and up. With your dominant hand, hold the syringe tip 1/2 inch outside the meatus, pointing toward the posterior ear canal. Slowly instill the irrigation solution and let it drain out. Continue irrigating until the ear canal is clean or all the solution has been used. Inspect the returned fluid for color, amount, cerumen, and foreign objects. After drying the child's ear and surrounding area, use an otoscope to inspect the inner ear. If the tympanic membrane is not visible, repeat the irrigation. If it is visible, place a cotton ball or gauze pad in the meatus to collect additional fluid. To further promote fluid drainage, position the child on her side and have her remain that way for about 10 minutes. For a child who must receive otic medication or ear irrigations at home,
you're going to pull her ear back and down.
Teach the parents how to instill eardrops or perform irrigation.
2 drops into her ear canal. You're going to massage her ear canal.
Before administering aerosol therapy, assess the child's breath sounds, work of breathing, and oxygenation to establish a baseline.
Now, this medication should help Chloe breathe more easily.
If therapy with an aerosol nebulizer is prescribed, place the diluted medication in the nebulizer reservoir and attach the nebulizer to the oxygen source. Then set the oxygen to the prescribed flow rate. For a young child, hold the nebulizer mask over her nose and mouth.
Is that pretty good stuff? Oh, I know, sweetheart. It's okay. Even though she's squirming, she's getting the medication, so. So, Ryan, what I need you to do is just open your mouth, and we're going to put this in your mouth. Okay? Good job. And close your lips nice and tight around it. Good.
For an older child, place the plastic mouthpiece between his lips and help him hold it in place with a good seal around the mouthpiece. Then instruct him to take slow, deep breaths. Near the end of the treatment, tap the reservoir to ensure that all the medication is administered. Continue the treatment until the nebulizer reservoir is empty. If therapy with a metered dose inhaler is prescribed, insert the inhaler into the holder.
Okay, Ryan. To use the inhaler, you just want to put your thumb on the bottom and your 2 fingers on top like this. You want to try that? Mm-hmm. Perfect. Now put it in your mouth and seal your lips nice and tight around it. Very good.
With the inhaler
Press
upright,
down on the
Have the child position the mouthpiece in one of 3 ways.
Go. Good. And hold your breath. 1, 2, 3.
As an alternative, have the child hold the inhaler about 1 inch from his mouth.
Good job.
If a spacer will be
Shake
used,
it.
attach it to the inhaler.
Insert it into the spacer.
Or if the inhaler has a spacer, have the child wrap his lips around its mouthpiece.
Okay. You want to try it? Okay. Exhale. Nice seal. Press down and inhale slowly for 5, 2, 1, 2, 3, 4, 5. And hold it. 1, 2, 3, 4, 5. When you remove the inhaler, you want to breathe out slowly through pursed lips like this. How do you feel now, Ryan?
I'm okay.
Okay.
As part of your follow-up care, teach the parent and child how to perform aerosol therapy at home if prescribed.
Then this sort of expands like an accordion. It goes on the one end. The mouthpiece goes on the other side, like so. This small end of the tubing goes on the bottom of the medicine cap. Okay, bottom of the little medicine bottle. Ryan, could I get you to hold that for me, please, for a moment? Then you're going to just lift the lid on the nebulizer. The other end goes onto that little spout in the nebulizer. Can I borrow this for a moment? You're going to unscrew the lid. You're going to put the medication right in the reservoir, like so. Right like that. And then you're going to make sure that you put the lid on and lock it tight. It sort of twists on. Okay? And then you can hold that. And there's a switch right here. You just flip it on. And then you can breathe. Okay? And be sure you use it until all the medication's gone. Okay? Any questions?